deep dive into a topic that affects
Millions.
millions of people.
Yeah.
The link between diabetes and cataracts.
Absolutely.
Now, if you have diabetes
Mm-hmm.
or just want to understand this connection better,
Yeah.
this one's for you.
For sure.
And if you're enjoying these deep dives, don't forget to like,
Yeah.
share, and subscribe to Visions Beyond.
Visions Beyond.
So
Yeah.
we've got research from the American Diabetes Association, insights from ophthalmologists,
Absolutely.
and we're ready to break it all down for you.
Yep.
So how about we start with a story?
Okay.
Okay, imagine this. You're driving home one evening,
Uh-huh.
and as the sun sets,
Right.
everything starts to look
Yeah.
blurry.
Blurry.
Streetlights seem hazy, colors look washed out,
Mm-hmm.
and you find yourself squinting to see clearly.
Oh, yeah.
What you might not realize is that this could be the early stages of a cataract.
Yeah.
And if you have diabetes, you're at a much higher risk of experiencing this.
That's a great way to illustrate the impact.
Yeah.
And you're right. Diabetes does significantly increase the risk.
Okay.
In fact, people with diabetes can be up to 5 times more likely to develop cataracts,
Wow.
and often at a younger age.
5 times. That's a pretty alarming statistic.
It is.
But what's the connection here?
Yeah.
How does something that affects blood sugar end up clouding the lens of the eye?
Well, the lens of your eye needs glucose for nourishment,
Okay.
just like other parts of your body.
Right.
This glucose is delivered through a fluid called the aqueous humor.
Mm-hmm.
When you have diabetes and your blood sugar levels are high,
Yeah.
excess glucose ends up in this fluid, and that's where the problems begin.
So too much sugar is essentially baiting the lens of the eye.
Yeah.
I can see how that wouldn't be good.
Right. This excess glucose can lead to a couple of key issues.
Okay.
First, it causes the lens to swell.
Okay.
Think of it like a sponge soaking up water.
Uh-huh.
As glucose enters the lens, it draws water in with it,
Yeah.
disrupting the lens's delicate structure and making it cloudy.
So it's not just about sugar making the lens sticky.
Right.
It's actually changing its internal structure, making it swell up.
Yeah,
That's a bit unsettling.
it is. And then there's another process called sorbitol buildup.
Okay.
There's an enzyme in the lens that converts some of this excess glucose into sorbitol,
Yeah.
a type of sugar alcohol.
Sorbitol buildup.
Mhm.
Why does that matter? Is it also drawing in water?
It does contribute to water retention,
Okay.
but it also directly damages lens cells and proteins,
Okay.
further clouding the lens. Imagine these sorbitol molecules as tiny little wrecking balls,
Oh, wow.
bouncing around inside the lens and causing damage over time.
So we have the lens swelling the sorbitol, wreaking havoc.
Yep.
It's like a double whammy of sugar-induced
Yes.
damage.
Exactly.
And this is all happening just because of high blood sugar levels.
Exactly. And if that wasn't enough, high blood sugar also triggers something called oxidative stress in the eye,
Okay.
which further contributes to cataract development.
Yeah. Okay. Oxidative stress. That's a term I've heard before, but I'm not sure I fully understand it. Can you explain it in a way that makes sense for those of us who aren't scientists?
Of course. Imagine tiny little rust particles attacking the delicate parts of your eye.
Okay.
That's essentially what oxidative stress is.
Uh-huh.
Damage caused by unstable molecules called free radicals.
Okay.
These free radicals are generated naturally in the body,
Right.
but high blood sugar levels make them go into overdrive,
Well,
causing more
yeah.
damage than usual.
So these free radicals are like tiny little troublemakers wreaking havoc in the eye.
You got it.
I'm starting to see a pattern here. Too much sugar seems to unleash a lot of bad stuff.
You're catching on. And there's one more culprit we need to discuss when it comes to diabetes and cataracts.
Okay.
Something called AGs.
AGs.
Yeah.
As in how old we are? I thought we were already talking about that.
Not quite.
Ah.
In this context, AGs stand for Advanced Glycation End Products.
Oh, okay.
It's a mouthful.
I know. All right, so what are these AGs all about? How do they fit into this whole diabetes-cataract equation?
Think of AG as like tiny bits of sugar that glom onto the lens of your eye,
Okay.
making it stiff and cloudy over time.
Uh-huh.
This process happens naturally as we age,
Right.
but it's accelerated in people with diabetes.
So it's like these AGEs are adding insult to injury on top of all the other damage that high blood sugar is causing.
Precisely. And this is why controlling your blood sugar levels is so crucial if you have diabetes.
Yeah.
It's not just about feeling good today, it's about protecting your vision for years to come.
This is all pretty sobering news for anyone with diabetes. It seems like your risk of developing cataracts is significantly higher no matter what. But I'm guessing it's even more concerning for younger people with diabetes.
Absolutely.
Hmm.
If you've had diabetes since childhood or developed type 2 diabetes early on,
Right.
your risk is even higher.
Yeah.
That's why early detection and management are so important.
So if you've had diabetes for a while, you're essentially dealing with a pre-existing condition for your eyes. That's a good way to put it.
It's a bit scary. But before we get into the specifics of what you can do, I'm curious.
Yeah.
We've been talking about cataracts in general,
Hmm.
but are there different types of cataracts that people with diabetes should be particularly aware of?
That's a great question.
Yeah.
While there are 3 main types of cataracts,
Okay.
2 are particularly common in people with diabetes:
Okay.
nuclear sclerotic cataracts
Okay.
and posterior subcapsular cataracts.
Okay, let's break those down. What are nuclear sclerotic cataracts?
Nuclear sclerotic cataract develop in the center of the lens.
Okay.
They tend to develop slowly
Mm-hmm.
and are common in both people with and without diabetes.
Okay.
However, people with diabetes often develop them at a much younger age.
So even if these types of cataracts are common in general, diabetes can speed up their development.
Exactly. And then there are posterior subcapsular cataracts.
Mm-hmm.
These develop at the back of the lens and tend to progress faster.
Okay.
They can significantly impact reading and night vision because of their location.
And they're particularly common in people with diabetes.
So even the type of cataract can be different depending on whether you have diabetes.
That's right.
That really highlights how diabetes changes things at a fundamental level.
Mm-hmm.
But what can you actually do to protect your vision, knowing all of this? I imagine blood sugar control is key.
You're absolutely right. Managing your blood sugar levels is the single most powerful thing you can do to prevent or slow the development of cataracts
Okay.
and other diabetic eye complications. Work closely with your doctor to achieve and maintain your target blood sugar levels.
It sounds like that's a constant battle for people with diabetes,
It can be.
keeping those blood sugar levels in check. But clearly, it's a battle worth fighting when it comes to protecting your vision.
Mm-hmm.
Are there any other lifestyle changes that can help?
Absolutely. Regular eye exams are non-negotiable,
Okay.
especially if you have diabetes. Early detection is key to managing any eye condition effectively.
How often should someone with diabetes get their eyes checked?
At least annually. But your doctor might recommend more frequent visits depending on your individual situation and risk factors.
Got it. Annual eye exams at a minimum.
Yeah.
What about diet? Does that play a role in eye health?
Absolutely. A healthy diet can do wonders for your overall health,
Yeah.
including your eyes.
So what should people be focusing on? What are the eye-friendly foods?
Think antioxidants like vitamin C and E,
Yeah.
citrus fruits, nuts, seeds. Those are all great sources.
Mm-hmm.
And don't forget leafy greens. They're packed with lutein and zeaxanthin,
Yeah.
which are like internal sunglasses for your eyes.
So salads really are good for you, even for your eyes. But what about things to avoid? Are there any bad habits that can damage our eyes?
Unfortunately, yes. Smoking and excessive alcohol consumption are particularly harmful to eye health.
So quitting smoking and cutting back on alcohol, good for your eyes and your overall health.
Exactly.
It's a win-win.
Ah,
What about sun protection? Do we need to be thinking about that too?
absolutely. UV rays from the sun can accelerate oxidative stress in the eyes. So wearing sunglasses that block 100% of UVA and UVB rays is crucial whenever you're outdoors.
So sunglasses are more than just a fashion statement. They're actually protecting our vision.
That's right.
We've covered a lot of ground in terms of prevention.
We have.
But what if you've already been diagnosed with cataracts?
Mm-hmm.
What are the treatment options?
The good news is that cataracts are treatable,
Oh,
even if they've already developed.
okay.
There are both non-surgical and surgical options available,
Okay.
depending on the severity of the cataract and how it's affecting your vision.
That's reassuring to hear.
Mm-hmm.
Let's start with the non-surgical interventions. What can
Yeah.
be done for early-stage cataracts?
In the early stages, simple things like new glasses with an updated prescription,
Okay.
magnifying lenses for reading, and brighter lighting in your home
Mm-hmm.
can help improve your vision and make daily tasks easier.
So these are like workarounds until the cataracts progress further.
Exactly. They won't stop the progression of the cataracts.
Okay.
But they can help you maintain a good quality of life while you and your doctor monitor the situation.
And what about when those strategies aren't enough anymore? What happens then?
When cataracts significantly impair your vision,
Yeah.
cataract surgery becomes the most effective treatment. It's a very common procedure, and it's quite successful.
Okay, tell us about cataract surgery. What does it involve?
The surgery involves removing the clouded natural lens
Mm-hmm.
and replacing it with an artificial lens called an intraocular lens, or IOL, This IOL becomes a permanent part of your eye.
So it's like a lens transplant.
That's a good way to think about it. The technology for these IOLs has advanced tremendously over the years.
How successful is cataract surgery? What kind of results can people expect?
Cataract surgery is highly successful. Over 90% of patients regain clear vision.
Wow.
It's generally a very safe and effective procedure.
But are there any specific risks for people with diabetes?
Diabetics might have a slightly higher risk of complications, such as swelling in the retina. But with proper pre- and post-operative care, these risks can be minimized.
Okay.
It's important to have open communication with your doctor about your diabetes and any other health conditions you have.
So communication is key, especially when it comes to surgery. But it's encouraging to know that even with diabetes, cataract surgery can be successful.
Yeah.
Now, I know we've been focusing specifically on cataracts today, but I also know that they're just one piece of the puzzle when it comes to diabetes and vision.
Yeah.
There are other potential eye problems associated with diabetes, right?
You're absolutely right. Diabetic retinopathy and glaucoma are two other conditions that we need to be aware of.
Okay.
They can have a significant impact on vision if not managed effectively.
Well, I think that's a great segue into our next segment. We've covered a lot of ground on cataracts, and now let's dive a bit deeper into these other eye conditions that can be affected by diabetes.
You're right. It's important to understand the bigger picture when it comes to diabetes and eye health. While we focused on cataracts, let's talk about diabetic retinopathy.
Okay. You mentioned diabetic retinopathy can lead to vision loss if it's not addressed.
Right.
Can you unpack that a little? What's actually happening in the eye?
Diabetic retinopathy is a serious complication that develops when high blood sugar levels damage the tiny blood vessels in the retina. The retina is that light-sensitive tissue at the back of your eye responsible for sending those visual signals to your brain.
So high blood sugar is the culprit here again.
Unfortunately, yes. Over time, high blood sugar can weaken and damage those tiny blood vessels in a few ways. Sometimes the damaged vessels leak fluid or blood into the retina, causing swelling and blurry vision. That's called diabetic macular edema, or DME, which we touched on earlier.
Right. You mentioned that DME can worsen cataracts.
Exactly. But there's more. Sometimes those damaged blood vessels close off completely, depriving parts of the retina of oxygen and nutrients.
That doesn't sound good.
Yeah.
What happens then?
The retina tries to compensate by growing new blood vessels. Okay.
That sounds like a good thing, right?
Yeah, you'd think so.
Unfortunately, these new blood vessels are abnormal and fragile. They tend to grow in the wrong places and leak even more easily than the original vessels.
Oh, geez.
This can lead to further swelling and even scarring of the retina.
Oh, my goodness.
In some cases, they can even cause traction on the retina,
Oh, wow.
potentially leading to retinal detachment.
So uncontrolled diabetes can set off this whole chain reaction in the retina,
Yes.
leading to a cascade of problems.
That's exactly right. And the longer you have diabetes and the less controlled your blood sugar levels are, the higher your risk of developing diabetic retinopathy becomes. It's a serious condition.
Right.
But thankfully, there are things you can do if you're diagnosed.
That's good to hear. What are the treatment options for diabetic retinopathy?
Treatment really depends on the stage and severity.
Okay.
In the early stages, managing your blood sugar and blood pressure effectively might be enough to slow or halt the progression. So those healthy habits we talked about earlier are crucial here as well.
Absolutely. But for more advanced cases,
Okay.
more proactive treatment might be necessary.
What kind of treatment are we talking about?
One common treatment is laser surgery.
Lasers in the eye. That sounds a little intense.
It does sound intimidating, I know, but it's actually a very precise and controlled procedure.
Okay.
The laser targets and seals leaking blood vessels
Okay.
or destroys abnormal ones to prevent further damage to the retina.
So it's kind of like cauterizing a wound, but on a microscopic level?
Exactly.
Are there other treatment options besides laser surgery?
Yes, sometimes injections of medication into the eye are used.
Into the eye. Ouch. That can't be pleasant.
I know it doesn't sound fun, but it can be very effective.
Okay.
These medications help reduce swelling in the retina
Okay.
and slow the growth of those abnormal blood vessels.
It seems like there's a lot that can be done to manage diabetic retinopathy if it's caught early enough. Are there lifestyle changes that can help as well?
Definitely. As with most health conditions, a healthy lifestyle can make a difference. Eating a balanced diet, exercising regularly, maintaining a healthy weight, and not smoking, they all contribute to better blood sugar control, which is key for managing diabetic retinopathy.
So it's really a holistic approach, taking care of your overall health to protect your vision.
Absolutely.
Now, we can't forget about glaucoma. You mentioned diabetes, doubles your risk for that as well.
That's right. Glaucoma is a condition that damages the optic nerve.
Right.
That's the nerve that carries visual information from the eye to the brain.
And what causes that damage? Is it high blood sugar again?
High blood sugar can contribute to some types of glaucoma.
Okay.
But the main culprit in most cases is high pressure inside the eye, known as intraocular pressure.
How does that pressure build up in the eye?
The eye constantly produces fluid called aqueous humor, which circulates and provides nutrients.
Right.
There's a drainage system that removes this fluid to maintain a healthy pressure balance. But sometimes that drainage system doesn't work properly.
Oh, no.
The fluid builds up, increasing the pressure inside the eye.
And that's what damages the optic nerve.
Exactly. Over time, this high pressure can damage the delicate fibers of the optic nerve.
Oh, wow.
Leading to vision loss.
Okay.
The tricky thing is that glaucoma often develops slowly and without noticeable symptoms in the early stages.
So you might not even realize there's a problem until it's too late.
That's right. That's why regular eye exams are so crucial.
Right.
Especially for people with diabetes who are at increased risk.
Yeah.
Your ophthalmologist can measure your intraocular pressure. And examine the optic nerve for signs of damage.
What can be done if they find signs of glaucoma?
The good news is that glaucoma is treatable.
Okay, good.
Especially if detected early.
Okay.
The goal of treatment is to lower that intraocular pressure and prevent further damage to the optic nerve. Often this is done with eye drops that help decrease the production of aqueous humor or improve its drainage.
So medication can help regulate the fluid balance in the eye. Are there other treatment options?
In some cases, laser surgery or traditional surgery might be recommended to improve fluid drainage. It really depends on the individual case.
It sounds like there are a few approaches, but the key is early detection. So those treatments can be effective.
Exactly.
So to recap, we have diabetic retinopathy, which affects the blood vessels in the retina.
Right.
And glaucoma, which is all about high pressure inside the eye.
Yes.
And both of these are more common in people with diabetes.
Exactly. And both can have a significant impact on vision if not managed effectively.
What's the takeaway message here for our listeners? What can we do to protect our eyes from these potential problems?
The most important message is this. If you have diabetes, prioritize your eye health. Take control of your blood sugar levels, get regular comprehensive eye exams, and work closely with your eye doctor to monitor any changes in your vision.
It's all about being proactive and informed.
Absolutely.
Earlier, we talked in depth about cataracts. Anything else someone with diabetes should keep in mind when it comes to cataracts specifically?
That's a great question. One thing to be aware of is that cataract surgery can be a bit more complex for someone with diabetes.
How so? What makes it more complicated?
Well, as we've discussed, diabetes can affect various parts of the eye, not just the lens.
Right.
During cataract surgery, your ophthalmologist needs to carefully assess the health of your retina and optic nerve and address any other issues that might be present.
So it's a more comprehensive approach to surgery, taking into account all the potential complications of diabetes.
Precisely. And because diabetics are at a higher risk for post-surgical complications, your doctor might recommend additional precautions or treatments to minimize those risks.
That makes sense. It's all about minimizing risks and maximizing the chances of a successful outcome.
Exactly. And speaking of outcomes, it's important to reiterate that cataract surgery is generally very successful, even for people with diabetes.
That's good to know. That's really reassuring to hear for folks.
Absolutely.
It feels like we've covered a lot of ground in this deep dive.
We have. We've really gone into detail about the connection.
It's clear that diabetes and eye health are
Yeah.
deeply intertwined.
Deeply intertwined.
Yeah, from cataracts to retinopathy and glaucoma.
Mm-hmm.
Managing your diabetes is
It's essential.
crucial.
It's essential for protecting your vision.
Yeah, it can feel overwhelming when you think about all the potential complications. But it seems like the key takeaway here is awareness and proactive care.
I couldn't agree more. Knowing the risks and getting regular checkups can make a world of difference. Early detection is often the key to successful treatment and preserving your vision.
And it's also about working closely with your doctor, right? They can help you create a personalized plan to manage your diabetes and monitor your eye health.
Absolutely. Open communication with your healthcare team is essential. Don't hesitate to ask questions and advocate for your own well-being.
And don't forget about those healthy lifestyle choices
Right.
we discussed,
Yeah.
right? Managing your blood sugar, eating a balanced diet, exercising, and avoiding smoking, those things all play a role in protecting your vision.
It's all connected. Taking care of your overall health is one of the best things you can do for your eyes.
Yeah, we've explored a lot of information today. If you're feeling overwhelmed, remember that you don't have to tackle everything at once. Start with small steps, schedule that eye exam, talk to your doctor about your blood sugar, add some leafy greens to your diet.
Every little bit counts. And remember, even if you are facing a diagnosis like cataracts,
Right.
there's hope for clear vision. Advances in treatments and technology are constantly evolving.
It is really amazing to see how much progress has been made
It is.
just in the last couple of decades.
Absolutely.
I think that's a wonderful message to end on. There's hope, and there are things you can do to take control of your eye health, and as always, knowledge is power. We hope this deep dive has empowered you to take charge of your vision and your well-being.
It's been a pleasure discussing this important topic with you.
And to all our listeners, thank you for joining us for another deep dive into the world of vision and eye health. Don't forget to like, share, and subscribe to Visions Beyond. We'll be back soon with more insights and information to help you see the world clearly. Until then, take care of yourselves and keep those lenses crystal clear.